Hello, welcome to another edition of To the Point, produced so generously by the American Acupuncture Council. I'm your host today, Virginia Doran, and I'm going to be speaking on my specialty, facial rejuvenation acupuncture, specifically guidelines for practicing this. So, without any delay, let's get into it. Guidelines for practicing facial rejuvenation acupuncture. You want to always pre-screen your patient for any possible contraindications. I would do this on the phone with people so that there's no misunderstanding when they come in. You want to give your patient realistic expectations. You don't want to promise the moon. It's always better to understate what you believe the effects will be. In time, after you've taken several people through a treatment series, you'll be better equipped to tell them, more realistically what that person can expect. But you don't want to overstate things ever. And I would say that, as a practitioner, so that the effects tend to be that you might take 5 to 15 years off of somebody's face. I've seen it 20, but that's not so typical. In middle age, it might more typically be 10 years, but you can't promise that. There's no way to be able to really guarantee people. And sometimes the effects is not only based on your technique, but their lifestyle. So on that initial phone call, when they want, before their first office visit, you want to forewarn them or have your staff forewarn them about the possibility of bruising on the face. Now, in a previous show, I talked about bruising and how to prevent it, as well as a different show on contraindications. So look those up. Be sure you see them before you practice any of this. Bruising is the biggest challenge, and the face is so highly vascular. And as we age, there's more chance of bruising as the vascular integrity becomes compromised. So be sure and know what you're doing and how to prevent and treat bruising to minimize any of that. And also for your own sake, because bruising is not good advertising. So needling has to be done very carefully on the face to avoid bruising and any adverse reactions. So I really recommend using very fine gauge, very, very thin and high quality needles. You want a good smooth tip. And of course, with something like a silicone coating, you're going to make it far less painful for people. The thing about the needle tips is there was some research done in Korea by a university there looking at needles under a microscope. And they found that 0.5%, a half of a percent of the expensive Japanese needles with the silicone coating had the coating come off under a microscope, whereas the inexpensive Chinese and Korean needles had up to 88% of those needles were shown to have the coating come off. So I know people are, nervous about a coating on a needle, but silicone is used in medicine, and it's a lot less likely to cause a reaction than some of the other coatings. That almost every needle has a coating on it. And what I see, if people use the cheap needles, that sometimes it leaves a black mark on the face temporarily from the coating, but some people will have an allergic reaction to that. So I can't emphasize enough how important it is to use good quality needles. There's in some things like exercise, there's an idea that no pain, no gain. That's not true with acupuncture. In fact, the inverse may be true. The functional MRI imaging that research that's been going on at Harvard has shown that when there is a painful needle insertion, there is less endorphins produced in the brain and less of a healing response produced in the brain. So my Japanese acupuncture mentor that I was so fortunate to be an apprentice with for 5 years before she passed, Yuriko Yamagishi, she always said that zip up the arm, that, dull aching sensation that you might feel with a needle insertion, that's not the chi. The chi is much more subtle than that. And I'd always say to her, well, what about this strategy? And what about this and that? And she'd say, don't worry about it. Just painless insertion. And I, was a student and had a head full of ideas. And I, was very kind of relieved to see that was so important and that she had taught me a gentle Japanese needle insertion. So that's something I recommend, everybody, no matter how you're thinking, TCM wise or Korean acupuncture, 5-element, what have you, medical acupuncture, a gentle insertion, I think for almost everything will serve you better. And it's something I always teach in my workshops, because you don't want, especially if you're doing it on the face, you want a very gentle insertion. I would say that number 5, a course of treatment is generally 12 sessions. You could say 10 to 15, and you could do it once or twice a week. But I think it is more efficacious if you do it twice a week. Or at least twice a week for the first 3 weeks, because the effects of any kind of acupuncture are cumulative. And you're going to see that the effects will last longer. They'll last in between treatments better if you're doing it more frequently in the beginning, till the spleen is tonified and can hold the effects of what you're doing. And actually, there's been some research that John McDonald wrote about with the Acupuncture Now Foundation with Matthew Bauer, about that the frequency of treatment for acupuncture in general, what they call the acupuncture dose, in a lot of the research where they show really, significant statistically and clinical results, and long-lasting results, was done twice a week for 6 to 8 weeks. Of course, it could depend on the condition and the individual, but that seems to be a good, treatment frequency. And in fact, in China, they often treat people every day. But we may not have the time or the money or the ability to do that here in the West. So twice a week, if you can, is the best. But you'll figure out what works for both your schedule and your patients and their budget, of course. Now, I would say for number 6, often you can derive relief of pre-existing conditions. Right. So some special health conditions related to other parts of the body may be treated during a facial rejuvenation acupuncture treatment series. So, for example, if somebody had chronic loose stools and they were sagging prematurely, you have to fix their spleen. You have to, their Chinese spleen, their large intestine, so that they will not be compromised that way, and so that the results of the lifting techniques and things you're doing for the sagging are going to be lasting and effective. So, of course, we're always treating constitutionally. So, sometimes there's a problem say somebody has back pain and they come to you for this treatment series. It may be not so good to do it at the same time of that treatment. You could do it, in a different treatment, because when they lay face down, if you're treating their back, then, it makes their face look all puffy and everything, just like after you've had a massage with your face down. So, and sometimes you can use distal points where it's going to help something back related or joint related, but generally I like to keep the focus on what you're doing with this. So, many people say that their hearing has improved, their eyesight, their thyroid balance, whether it's hyper or hypo, have all improved from the facial rejuvenation acupuncture treatment series. Rosacea has disappeared without even doing anything specific for that. I mean, it's really so many other things, hormonal balance improved, you name it, because we're, of course, using constitutional points. In general, I would say, number 7, you want to avoid blood vessels in general on the face when you're needling the face. And then, of course, I found that you can bleed broken capillaries, and that that could be done at the same time, but not. I would do it after the treatment when the blood is well into the face, and because it's a bit of a painful technique, the bleeding, the broken capillaries, doing it after. But anyway, maybe another show we'll talk about that. You don't want to needle into an ulcerated, irritated, or bruised area. You could needle contralaterally, you could needle somewhere else along that meridian perhaps, but not directly into those things. And also, you don't want to needle into a wart or a mole that's pigmented. The Chinese have all sorts of techniques for this, fire needles on moles and things. That's another issue. But as a general guideline for practicing facial rejuvenation acupuncture, don't needle into warts and pigmented moles. Now, I would say you want to keep your mind, your awareness at the end of the needle to feel the appropriate tissue level to insert. For some skin conditions, especially with Japanese acupuncture, you would needle shallowly, even on a point like large intestine 4, to affect the way level more. It can be helpful also to hold the skin taut. If you're inserting an intradermal, you hold it taut in the direction of the, say the wrinkle or the scar that or direction of the meridian that you're working on there. The acupuncture needles should be removed slowly and gently for this purpose. Now, I know about theories of tonification and dispersal with a quick insertion and a slow removal and a slow insertion and a fast removal. You can always do the tonification with your intention or dispersal if that the case may be. But for this purpose, it gives a chance for the blood vessels to seal up so that there's less bleeding and bruising. It's never a gusher anyway, but you just, you don't want to take a chance of bruising something, especially on the face. So you have your cotton ball and Q-tips on hand. You press down on the spot with a sterile cotton ball or Q-tip and using just a little firmness and maybe having ice on hand and any anti-bruising agents, which again, you can see the show on bruising for more information on that. So when do you see results? People want to know. Patients want to know, of course, rightly so. Usually you'll see something as early as the first treatment. And it's generally around mid-treatment series, the 6th or 7th session, that the results are more dramatic and lasting. Meaning if they had to take off a couple of weeks because they were going on vacation or something, that their results wouldn't slip back, and that you're really starting to see the potential of what you can achieve with this. In some exceptionally difficult cases, the course of treatment may need to be repeated again. I haven't had to do it again, but I've extended it with a few people where the results it was still improving. We hadn't reached a plateau. For instance, age spots. They generally lighten and shrink up gradually. And so I had a patient who had a serious issue with age spots, and we were still getting results of the 12 sessions. So we went on for another half dozen sessions because this was something important to her, and got some really great results. In China, they tend to do a series of 15 and then another series of 15 and another series of 15. I don't think if you're doing a very kind of involved, advanced, specific treatment like what I'm advocating, that's necessary, or certainly not close together. But how long do the effects last, right? You can't really predict it. Even with cosmetic surgery, they say, well, it depends on lifestyle and the age of a person, and it's the same with this. But so that you have a general idea, I would say 2 to 5 years with maintenance sessions. Now, I have seen it last a lot longer with people who continued the maintenance. But if somebody doesn't have a good lifestyle habits, or they have some, big trauma in their life, then it may not be longer than those amounts. But it's, the maintenance sessions are the key, and they can be done once a month or they can be done seasonally. So I would say to patients, oh, you want to do this to maintain the results and maintain your health, because my emphasis was on the health. And they would say, oh, yeah. Everybody talks wellness and prevention, but people don't want to necessarily take the time and money to always do that. So I think that if what is important to them, their looks, but also their wallet. So if you kind of emphasize to them that this is going to protect both their health and their investments so that it lasts longer, so they get the maximum effect from it, that seems to get through to people a little bit more than their health. So some general guidelines of, the order of insertion and removal. I have a much more detailed order than this that I'm going to go into, but this can give you general guidelines for doing it. So I start with the ear needles, and I start with them because they are going to release a lot of endorphins and make the face slightly anesthetized so people tolerate it better. And also, when they're flooded with those endorphins, they're very relaxed on the table. They're probably even asleep by the time you get to their face. Then I follow that with points on the feet to ground the energy. So gallbladder 41, first body point in after the ears, and then it's going to be your last body point out, so that you always have that gallbladder chi anchored to the end, so that to avoid dizziness and headaches. And it works great. So points on the feet are followed by points on the legs, the trunk, the arms, the hands, and then the face points are inserted last. In fact, I do the scalp points before the face points because you need to be able to, the protocol I'm teaching, do certain things on the face and then going up to the scalp without having needles in the face, which would encumber your ability to do these specific techniques. So when you're removing the needles, you want to have your anti-bruising agents on hand, your Traumeel tablets, trauma care, whatever it's called now, the Helichrysum Italicum hydrosol, the Helichrysum Italicum essential oil, and possibly ice to prevent any bruising. But again, you can watch the show on preventing and treating bruising. So when removing the needles, you want to remove them first from the ears because they've been in the longest, and they're also sticking out a little bit for taking things out of the scalp and the face. Then the head. Then the arms, especially large intestine 4 and lung 7, because they are bringing a lot of chi to the head, and the face, the skin, the way level. And so they're good to take out early on. So that it's like unplugging the treatment at that point. Then taking them out, the ears, the head, the arms, the legs, the feet last. So gallbladder 41, last point out. So I don't recommend trying for Da Chi on the face itself. Now, doing that in your practice for other things, that's fine. I, had that Japanese acupuncture mentor that I mentioned, Yuriko Yamagishi, and she always said that's not the chi. The chi is much more subtle than that. And I have found that to be the case. Anyway, because we're using a lot of needles, we don't want a painful insertion or a strong Da Chi response. People still feel the effects of the chi profoundly, but that, hitting the nerve thing is not comfortable, and it could be overstimulating with so many needles. It's nice, number 23, if you needle the back shoe points at some point in the treatment series for the sake of balance. Doesn't have to be done, but I think it's a nice thing. And you would customize that, of course, for the person, what they need based on your differential diagnosis. But I would do it later in the series, maybe the 9th or 10th session, something like that, when your results have stabilized. And, you could do those shoe points, then turn them over and do an abbreviated face treatment if you're, if time allows, because that way they're still getting both. If you do like an aggressive energy treatment, as in 5-element, where they do the shoe points on the back, the first treatment, and you don't treat the face. And I can understand why you wouldn't want to do those two things in one treatment when you have that strategy, the aggressive energy treatment or the blocks. They will be dissatisfied because they're not going to see any difference, and you want them to be able to see some effect right away. Those are great treatments, but I wouldn't, do that in my initial treatment. If I'm doing the face at the same time, maybe preceding the treatment series would be my recommendation. It's contraindicated, from my point of view, to needle inside the orbital ridge, except for bladder 1. I don't know how that says orbital range, but it's orbital ridge, because it bruises so easily. And we also, especially just below the ridge, and most people aren't that precise. They do the orbital ridge here, and the orbital ridge on most people is way higher. And you, of course, wouldn't want to risk, needling close to the eye. So I was always saying no needling inside the orbital ridge at all. And then I realized, bladder 1 is actually just inside the ridge, but that requires specific needle technique and safety measures, and don't do it unless you know how to do it. Needling should be done bilaterally on the face. Now, you can do ipsilateral, contralateral, whatever you want with the body and, in your general practice. But if you want to see the same results, balanced results, you need to treat the face bilaterally. And I have a funny story about this. I had the first publicity thing I did, the TV cameras were just parked on one side of the patient and the table. And they said, we're in a hurry. Can you just do the one side? And I had already put in bilateral body points. And so I said, okay, I just treated the one side where the camera was. And then time ran out, and they ran out, and they didn't get to see the needles or the face after the needles came out. So the patient, because it went so late, then they had to go back to work. And so they got in the mirror and they said, oh my God, look at the two differences in the sides of the face. If only they caught it on camera. So if you're trying to do a demonstration for someone to show the difference of before and after, that's a possibility. It's not something you want to do all the time, which might, imbalance the chi temporarily. But for somebody who really needs to see the difference. Sometimes I'll treat part of the face and then show the patient, if they're awake, in the mirror, and then, continue with the rest of the face, but they get to see and feel that difference of the lift. So anyway, that's what I wanted to say about some guidelines. There's some other things, and talking about treatment preparation, things which I'll cover in another show. But the next show that I'm doing will be Peter Dedman speaking more about Yanshen. So don't miss that. And if you're interested in workshops, there's some articles I've written on my website. You can follow me on Facebook, now on Instagram. And then I have these videos and some other things on my YouTube. So hope to see you again. And again, thanks to the American Acupuncture Council. And don't forget to comment, to engage with the posts, to like them, share them, whatever, so that Facebook will distribute these things more widely. Okay, thanks. Bye.